Imagine laying there and seeing very little and minding your own business, and boom, it happens. Blackness has taken over your eyesight, your muscles go stiff and spasm beyond your control, and you have nothing to do but lay there, shake, cry, and sustain the pain. What I'm describing is a person with lissencephaly. This is a worldwide brain disorder that affects lives of many innocent people. Today I'm going to talk to you about lissencephaly and the effects it has on a person. First, I will tell you what lissencephaly is and some background information I found on it. Lissencephaly is a brain disorder that was first founded in 1914 by pathologists Kolb and Earhart, according to Healthline.com. Less than 100,000 people are living with lissencephaly today. The downfall of this disorder will also last with the person all throughout life and has many effects that can eventually result in a rough patch for families and result in death. Next, I'm going to talk to you about what causes lissencephaly. There's not one specific cause to lissencephaly, it just happens, but some things are believed to lead up to it. This particular disorder is gene-linked, meaning it can pass from one or both parents in your inherited genes. Infections during the first trimester of the mother can also be a lead to it. During mitosis, when the chromosomes are lining up and they touch, some of them become mutated and not lined up right. Again, there's no reason for this, it just simply happens. Also, injury or trauma to a female while pregnant can also interrupt the development of the fetus, leading to having insufficient blood flow to the brain or hurt the fetus. Microcephaly, also along with lissencephaly, which basically means small head, which also means small head. It is amazing how the deletion of the 17th chromosome can cause such a huge significance on a person. A brain abnormality is caused, which is the lack of the 17th chromosome when the cerebral cortex is missing on the human brain and causing it to be smooth. Last, I'm going to talk to you about the symptoms of lissencephaly. Some symptoms are severe and can take place at anyone's life at any time. Ataxia, which is also known as muscle control, and also allows muscles to spasm and sometimes not to be used at all. One other thing is mental retardation. This happens because of the missing cerebral cortex. Eating and failure to thrive is also a problem along the way. For example, my niece Payson was failing to gain weight and grow like a normal girl. Throwing up was always a problem for her until we found out that she was aspirating formula into her lungs, which was causing aspiration pneumonia. This is a #1 killer in children with lissencephaly and microcephaly. In order to prevent the aspiration, an NJ tube is placed through the nose, passing into the stomach and directly into the intestines. The NG tube can also be placed in the stomach through a surgical process that includes putting a hole in the stomach, tying the stomach into a knot so no food can come up. Slow development in growth is usual. A child not learning or doing things they should be doing at certain ages. For example, they have standers to help kids with these problems sustain weight or bear weight on their feet and have them in an upright position. They have their wrists, which are curved either back or forward, and their toes are also slightly curled. Also, with the effects of the face, they have a small forehead, and the ripple under the nose, in between the lip and the nose, that is flat. They do not have it, and their upper lip is very thin, as you can see on this picture. The small eye openings is also a common thing in majority of kids with lissencephaly do have glasses. And their small head, as you can see, she has a very small head, and there is different degrees of the size of brain and how bad lissencephaly can actually be. Payson does not have it bad enough, but has it enough to give her seizures and causing her not to walk. Seizures develop in over 3/4 of children with lissencephaly. Some can be controlled by medication and some cannot. Like in Payson's case, she has uncontrollable seizures but takes medicine to try to lessen the symptoms of them. Today I have talked to you about lissencephaly and what happens with this disorder, symptoms and effects it has on an individual. Lying on the floor with sudden flashes of pain everywhere in your body is never any fun. It is always best to find the disorder as soon as possible before it is too late. Lissencephaly may have a negative outlook on it, and it will affect a person's life forever.